In this video, we will be demonstrating all about operating room skills. Surgical sepsis. Sepsis is the body's overactive and toxic response to an infection that can lead to tissue damage, organ failure, and death. Surgical asepsis, the exclusion of all microorganisms before they can enter an open surgical wound or contaminate a sterile field during surgery. Measures taken include sterilization of all instruments, drapes, and all other inanimate objects that may come in contact with surgical wound. All personnel coming in contact with sterile field perform a surgical hand scrub with an antimicrobial agent and put on a surgical gown. Aseptic techniques are designed to maintain the sterility to prevent the contamination of a person, object, or area by microorganisms. Principles and practice of surgical asepsis. Surgical asepsis is indicated in the following instances. A. Whenever the skin is unintentionally diseased or injured. B. Whenever a body cavity that is considered sterile, such as urinary bladder, is inserted by a catheter. C. Whenever client skin is intentionally perforated or break for therapeutic purposes, like by a scalpel, to make a surgical incision. 9 basic principles of surgical asepsis. A. All objects used in a sterile field must be sterile. B. Sterile objects become unsterile when touched by unsterilized objects. C. Items that are out of vision or below the waist level of the nurse are considered unsterile. D. Sterile objects can become unsterile by prolonged exposure to air. E. Fluids flow in the direction of gravity. F. Moisture that passes through a sterile object draws microorganisms from unsterile surfaces above the elbow to the sterile surface. G. The edge of the sterile field is potentially contaminated by microorganisms moving in from the outside. H. The skin cannot be sterilized and is unsterile. I. Consciousness, alertness, and none are essential qualities in maintaining surgical sepsis. Surgical hand washing or scrubbing. Begin with proper attire. A newly laundered scrub suit with short sleeves, which is well tucked in the waist. A scrub cap that completely covers all hair and pierced ear studs. A fresh disposable mask that fits snugly and comfortably over nose and mouth. Specified shoes or slippers to wear in the department or OR suite. Remove your wristwatch and rings. Inspect hands for cuts, abrasions, or other problems. Ensure that fingernails are trimmed. Turn on the water and adjust the temperature to lukewarm. With hands above the level of the elbows, wet hands and forearms under running water from fingertips to the elbows. Dispense liberal amount of soap or antiseptic solution into hands. Beginning at the fingertips, lather hands and arms to the elbow, using firm, rubbing, circular, and interlace fingers technique. Move from fingertips to the elbows of one hand and repeat to the second hand. Continue washing for 20 to 25 seconds. Rinse thoroughly, keeping the hands higher than the elbows. Obtain sterile washroom container and apply a liquid cleanser. Using the anatomical pattern of scrub, Previously outlined 4 surfaces of each finger, thumb to fifth finger, over dorsal surface of the hand. Small finger to thumb over palmar surface of the hand, small to thumb finger over the wrist. Extend the scrub 2 inches above the elbows, giving elbow a few circular strokes. Time method. Apply a liquid cleanser if the brush is not impregnated with one. Scrub each hand for 45 seconds. Scrub each side of all fingers, including the skin between each of the fingers and the thumb and the back and the palm of the hand. Divide each arm into thirds. Scrub each lower forearm 15 seconds, each upper forearm 15 seconds, and the antecubital space to marginal area above elbow 15 seconds. Discard the brush without touching any part of the sink. Rinse the hands and arms thoroughly so that water flows from the hands to the elbows. Turn off the water with the foot or knee pedal. Proceed to the sterile work area. Wiping hands and arms with sterile towel. Reach down to the open sterile package and pick up the towel directly as one, holding it away at all times. Step back and open towel full length. Be careful not to drip water into the pack or touch sterile filled with your bare hands. Be sure no one within arm's reach. Holding one full length and one end away from non-sterile scrub, attire bend slightly forward to avoid towel touching attire. Dry both hands thoroughly by holding towel in opposite hand and using a slow circular rotating motion of the arm's fingers up to the elbow. Never return to an area you already dried. Carefully reverse the towel, still holding it away from the body. Dry opposite arm on the unused end of the towel. Discard the towel. Keep the hand in front above the waist. Gowning and close gloving. Pick up the gown in such a manner that hands touch only the inside surface at the neck and shoulder seams. Hold gown securely with both hands. Holding the inside of the gown just below the neck with both hands, allow the gown to unfold downward front of you, keeping the inside part of the gown toward the body. Do not touch the outside of the gown with bare hands. Locate the armholes. Work your hands and arms carefully into the gown and into the sleeves, as far as the seam between the sleeve, and making sure the sleeves do not touch the unsterile object. Circulating nurse brings gown over the shoulder by reaching inside to shoulder and arm seams, pulling it securely onto shoulders and the neck and the back waistline ties. Using close glove technique, putting on the sterile gloves. Use your right hand seal inside the gown to pick up the folded edge of the left glove. Hold your right hand out with the palm up, seal inside the sleeve. Lay the left glove on the left palm. Position it with the glove fingers pointing toward the elbow and the cuff end pointing toward the fingertips. With the left hand, grasp the right glove cuff by the top fold of the cuff end and pull the right glove cuff up and cover the right gown cuff. Adjust the left glove cuff over the left gown cuff, keeping the right hand inside the gown. Pick up the right glove with the glove left hand. Hold right hand, palm up, inside the gown sleeve. Place the right glove on the right palm with the glove fingers pointing toward the elbow and the cuff end pointing toward the fingertips. Grasp the top fold of the cuff edge with glove left hand and pull the glove cuff up and over the gown cuff. Turn up and adjust the cuffs of both gloves. Pull the glove fingers out at the ends to reposition the fingers if necessary. Establishing and maintaining sterile field. Opening a wrap package while holding it. Open the package as described using the other hand, pulling the corners of the fluffs well back. Inside the wrapper is considered sterile except for 1-inch border around the edges and may be used as base for sterile field to add additional items. Pick up the flaps closest to you, handling it at the corner and lay it over the contents. Make sure the corner is folded toward you as it was before the flap was opened. Select the side you open third. Pinch the side flap from the underside and lay it over the contents. Use right hand for the right flap and left hand to the left flap. Repeat for the other side. Pinch the far flap on the underside by reaching around the package and bring the flap over the contents. Tuck it in loosely. Adding necessary supplies. Open wrap package. With the free hand, grasp the corners of the wrapper and hold them against the wrist of the other hand. Place the sterile bowl and other supplies to a sterile field by approaching from an angle rather than holding the arm over the field. To add commercially packed supplies. Open the package, hold 6 inches above the field and permit the contents to drop on the field. Keep in mind that 1 inch around the edge of the field is considered contaminated. To add sterile solution to a sterile bowl. Hold the bottle of fluid at a height of 4 to 6 inches over the bowl and to the side of the sterile field. Carefully pour the solution so as not to splash the liquid. Handling sterile forceps. Hold the forceps above the waist level and within sight. Discard disposable forceps after use or send reusable forceps for repacking and sterilization. Isolation. Check the type of isolation ordered for the patient and identify the type of infection or the reason for protective precautions. Check the equipments on the stand outside the door or in the anteroom and inside the room. Perform hand washing. Gather and arrange all the equipment needed. Upon entering the room, carry out the aspects of isolation technique necessary for patients according to the type of isolation used. Identify the patient from the door. Explain the procedure to the patient and assess the client's understanding of the procedures and need for information. During the employment of isolation precautions, continually assess client's needs for stimulation. Note clinical signs of boredom, sensory deprivation, and anxiety. Give care as planned using appropriate techniques. Carry out technique necessary to leave room. Record on the client's chart those isolation precautions have been implemented. Cite the type, time, and client's response. Evaluate using following criteria: necessary equipment readily available, isolation technique correctly carried out, patient left comfortable and safe, no nosocomial infections originate from this patient. Surgical skin preparation. Before clipping, step 1. Drape the client. Expose only the area to be clipped at one time. You will clip about 15 cm at a time. Clipping. Step 2. Make sure the area is dry. Step 3. Remove hair with clippers. Do not apply pressure. Step 4. Move the drape and repeat step 2 and 3 until the entire area to be prepared is clipped. If applying antimicrobial solution, follow steps 9 and 10. Wet shaving. Step 5. Place the moisture-proof towel under the area to be prepared is clipped. Step 6. Lather the skin well with soap solution. Step 7. Hold the razor at about 45-degree angle to the skin. Shave in the direction in which the hair grows. Use short strokes and rinse the razor frequently. Step 8. Wipe excess hair of the skin with sponges. Cleaning and disinfecting. Step 9. Clean any body crevices such as the umbilicus, nails, and ear canals with applicators and solution. Dry with swabs. Step 10. If an antimicrobial solution is used, apply to the area immediately after it is clipped. Leave it for the designated time. Then dry the area with clean gloves. After clipping, Step 11. The skin preparation may need to be checked by the nurse in charge. Report to the nurse in charge any abrasions including those made by the clippers or razors. Step 12. Remove the waterproof towel and bath blanket carefully so as not to spill the clip hairs onto the bedroom. Step 13. Document the skin preparation on the client's chart.